Kaiser Permanente. Can we talk about it? Another healthy discussion. What's going on in the health sector? Kaiser Permanente strike? 75,000 people? What? How is this affecting the city near you? The urgent care now near you? How is it affecting grandma and grandpa? Or how about this? How is it affecting the spike? We all know there's a new variant out. So how is it affecting it? Smash that like button. Don't forget to subscribe. Listen to this.
Nearly 75,000 Kaiser Permanente workers are expected to walk out on October 4th if an agreement to resolve a staffing crisis is not reached by the end of this week. The
October 4th.
Largest
Check your calendar. What's today's date? This October 4th. They have until Saturday to come up to an agreement. They're demanding a higher wage. We all know that all sectors are being overworked right now. If it wasn't due to technology, I don't even know if we would have a current economy. Most of the people don't want to work. The immigrants are coming in. It's a lot of major distractions, right? The immigrants are coming in to take the spots of the people that don't want to work, but the people that's actually working on today, they're demanding more money. Now, how is that beneficial to the shareholders? That's actually not beneficial to the shareholders at all. And companies generally have their shareholders' best interests. Smash that like button if you agree. If you're investing in a company, I don't think they really care too much about the employees. You know? I don't think they care too much. But listen.
U.S. history and could cause a major disruption to the broader ecosystem. For more on what
Yes,
to
it
expect,
has.
we're joined by Caroline Lucas, Executive Director of the Coalition of Kaiser Permanente Unions. And for the impact on stocks, Mizuho's healthcare sector specialist Jared Holtz joins us as well. Welcome to you both. Caroline, we'll start with you. Tell us about the staffing crisis you're experiencing.
Thank you so much, Kelly.
Staffing crisis. See, that's the problem everywhere. They're hiring people. People aren't working full time. Just look at it it's two perspectives. Look at it from the worker's perspective. I'm getting hired, right? A job, just over broke. You're making minimum wage. The economy, inflation has always been going up. So that's priced in. But your wages doesn't go up. Gas prices is going up. That's not going to stop. Grocery prices is going up. Yesterday's price is not today's price, as Fat Joe would say. Smash that like button if you agree. Subscribe if you agree. But that's from the employee side. Health benefits, they don't get health benefits because they're getting hired part-time, not really full-time. If they do get benefits, they still have to come out of pocket. That's from the employee perspective. Now let's log in. I like the business perspective. This is from the business perspective. Why would I incentivize my workers when I got to make sure that my investors are treated the best? Because without them, I won't have any workers. Now, I would say for the business sector, I will probably invest in some type of technology that maybe can curb that number. They're trying to trim the fat in every industry, if no one have realized that. From the UAW strike, to the Hollywood strike, to the Targets closing, to the Rite Aid closing, to foreclosures. Like, this is what's happening today. But yet we're not in a recession. Subscribe to the channel if you know we are in a recession right now. But the news media and these legacy media is not telling you what the current state of it is. Why? Because they don't have your best interests. Right? It's like they can't give you a mass amount of fear. They can only introduce you to a dosage of it at a time. It can't be extreme fear. Pay attention now. I want people to pay attention. But listen to the employees' perspective of how the employees, what's going on with the employees.
About the staffing crisis now for years. We are really
She said for years. For years. So this is nothing new. So Kaiser Permanente, I guess nothing is really permanent now, is it? It's not. This may be a good opportunity for an option play. This may be a great opportunity for an option play. This is not financial advice, but you have to learn how to, where there's problems, there's solutions, right? Someone is winning and someone is losing. What side of the fence are you on? That's the question. That's always been the question.
Acts to not just worker safety, but also patient care of continually working short. And Kaiser executives are not showing up with the urgency needed to address this short staffing crisis.
So as I read here, patients are seeing, and these are, I assume, mostly hospital patients, wait times for appointments, medication, x-rays, phone responses, room assignments are intolerable and in some cases at dangerous levels. Kaiser wants to raise premiums.
So
by
basically
15%.
the response that you would have generally for a hospital is delayed. Now, we all know in the case of emergency, it takes about 30-40 minutes for ambulance to come anyway. And then when they drop you off at the hospital, you got to wait another hour, 15 hours, depending on where you go. Oh, that's a big problem. That's a big problem in America. Smash back that like button if you agree. Because it's going to be lines out the hospital door. Winter is coming. It's here. It's already a spike in variants. So what you think? Leave your comments down below. I really want to know what you think. Because it's going to affect you and I no matter what. It's going to affect you and I no matter what. But let's continue.
Providing less care. Do I sort of have that right as you guys see it?
Kelly, you nailed it. We are really concerned about a healthcare system that is showing up in a way that undermines the staffing levels needed to deliver the safe patient care that you and I as consumers count on.
Technology.
By the way,
Technology is going to be one of the solutions for this, because we already know the healthcare sector is under revision and renovation anyway. They have new robots coming out. They have new softwares coming out that can track your health and XYZ. Now, all the doctors will know globally what's going on with you. So access to your information, your blood type, that can save your life. Every second counts when you're in the hospital. Remember that. So every second delayed is counted against you. Smash that like button if you agree. Comment if you agree. Share this information if you agree, and subscribe to the channel if you agree.
Out of 85,000 may walk out. Is that because those 10,000 are critical?
85,000, Mom.
It's one thing to talk. I'm not saying the auto workers aren't essential, but nurses and that's a whole other level.
The UAV is essential. Everything depends on everything. How are the hospitals going to get their medical supplies without the UAV or the truckers or these automotive industries, right? Hollywood is going to a strike. Everywhere is striking. If you can't, just pay attention to the trend. Everyone is going on a strike because of the type of time we're in. The wealth gap has expanded. So what you think? 26 people have received more money than the majority, than 80% of the whole nation, of the whole global economy. What does that tell you? Money's been transferred at a rate and it's skipping you. It's skipping you. And the workers will pay for it. The middle class always holds the bag. The middle class always has to pay for the government decision on not being responsible or not having your best interest. They have their best interest, not yours. But that's all part of the game. Either you're going to win or you're going to lose. Your choice.
Absolutely. Every single one of our healthcare workers wants to be bedside with their patients. That's what they signed up for. That's what they worked on throughout the pandemic.
They're outworking them.
That's where
They
they want to be
outworking
today,
them.
tomorrow, and next Wednesday. But tens of thousands of healthcare workers, frontline healthcare providers, feel like they can no longer show up in good faith if we are not having the staffing levels needed to provide the care that we count on.
So do you think a strike is going to happen? If it's never happened before, what do you think the reaction by patients and so much else is going to be? And what are the sticking points? I mean, in the UAW strike, it all seems to come down to wage negotiations. Is that the case here?
Staffing are the sticking points. And what we want is simple. We want Kaiser executives to bargain in good faith with frontline healthcare workers.
Oh, so it's not really even about the wages. They're understaffed. So you can pay them more, but paying them more isn't a solution. They need more workers. So maybe this immigrant crisis is needed. It's needed because who else is going to work? Who else is going to properly work in the system and aid them? Comment down below. Let me know what you think. I would love to hear your
solve
thoughts.
the Kaiser short staffing problem, and we want patients to be safe and get the best possible
Safety
care when
is
they come to
first.
Kaiser facilities.
So you want a lot more nurses. Are you even asking for a pay raise?
You know, our comprehensive proposal covers a whole bunch of areas. It does include wages and benefits, because wages and benefits are a critical part of attracting the folks that we need in the healthcare industry and retaining the ones that we have. As I'm sure you know, we're seeing an exodus of healthcare workers, and we don't have enough new people coming in to staunch that tide.
Here's the statement that Kaiser Permanente gave
So
to
that's the real problem. It's the same thing with the police department, right? That's happening in New York. A lot of them are retiring, but there is no one else is coming in. It's the same thing with China economy. Why is China economy isn't growing right now? Because they don't have no one coming in, anyone new. They had that One Child Law Act that messed up the whole economy. You can only have one child. What? Per family. So you basically saying your future is tainted. There's beauty in numbers. There's growth in numbers. So smash that like button, subscribe. Let me know what you guys think about this Kaiser Permanente strike. Will they get what they rightfully deserve? Or would the business, or would Kaiser Permanente play hardball? Smash that like button. If you don't like it, smash that I don't like button, but let me know why. Subscribe so I can flow through the algorithm. Share this information, right? Because sharing is caring. Sharing, we all are in this together. So share this information, create awareness. On that note, peace, love, and blessings.